You know, you have been such a strong voice and exemplar for equity, both at ASPPH and in your school. And I remember when I first met you, and I went back to the school, and I said, "Oh, you've got to meet the new dean at Rutgers. He's just amazing." And it's been you've never disappointed me. I'm going to miss working with you. I really want to welcome all the faculty, staff, students, and partners from Rutgers, and a number of people from UNC who are here today. I want to thank the people who've given me help in putting this presentation together and accept all responsibility for any errors or mistakes. I want to thank Angelica Figueroa, who's helping me with the slides. She's our office manager, and the Rutgers team, and Matthew Chamberlain from our team. I also want to share my condolences to Rutgers University for the alumna who was murdered over the weekend in New York City. It's a terrible tragedy, and I'm really sorry about that. Next slide. Next slide, Angelica. So I want to focus especially today on what we've done to increase inclusive excellence at a school of public health in a southern state, on a campus that is trying to really confront its own history. And I'll say a little bit more about that history shortly. I've spent more than 25 years living in North Carolina, but I grew up not far from Rutgers in northeastern Pennsylvania, near Philadelphia, and I worked for 10 years at Fox Chase Cancer Center. So learning about Confederate monuments in the South was quite a learning experience for me, and I want to share some of the ways in which we're different from you, a state which is distinguished by having no Confederate monuments. So good work, New Jersey. Next slide. So today I want to share our experience, and it's got a lot in common with your experiences, to end racism and increase inclusive excellence from within the school. And I want to especially communicate what leaders, not just formal leaders, but leaders should do, and hopefully start a conversation about some of these issues. I have come to feel more and more strongly that leaders must be really visible exemplars for the work that they want to accomplish. And I think Perry is just a brilliant example of this. Next slide. But I also want to say that, you know, I speak through my lens. Obviously, I am a white person. I do my best to walk in the shoes, to try to imagine walking in the shoes of other people. But, you know, I represent my own history. Becoming an anti-racist school is a work in progress. You know, we're never going to be there. So I'm not here today to share, to tell you that we have arrived or that I've arrived. The longer I'm dean, the more I recognize how hard it is to move the needle on these issues. And Perry alluded to that. We don't control all the levers, and other factors affect what happens on campus, particularly campuses that are public universities like we are and Rutgers is. The pandemic overshadows so much of what is happening now. The killing of George Floyd awakened millions of people to injustice, but it didn't solve the problems of injustice. The issues around Nicole Hannah-Jones on our campus, although not in our school, affected and disaffected many. None of our actions occur in a vacuum. We must do the best we can. And so that is the frame that I come to you today with. Next slide. I think many people have spoken about the converging pandemics that we're facing. The disease pandemic of SARS-CoV-2, which we're all over with so much, but is not over. Racism and mental health crises and the economic crises that were really exacerbated by the disease crisis. Our students, our faculty, our staff, and our partners are all aware of and motivated by these forces. We're all tired, but this is no time to give up. Next slide. In fact, I think this moment gives us an opportunity to do the right things to accelerate change in our organizations and the world. It is a public health moment. And having been in this field for many years, I am struck by how many people in our communities and our universities are really interested and see the value of public health. And that gives me reason for optimism around the pandemic bloom. Next slide. As my time as dean lengthened, I realized that we needed an organizational ethos, a culture, a focus around inclusive excellence. And we've been working at this for many years, long before I became dean and since I've been dean. But I think the things that have become really clear to me over the last few years and I want to talk about are the need to converge around a plan and to see that plan as having both organizational policies and behaviors and personal actions and ethos. And when I say ethos, I'm really referring to the set of moral beliefs, attitudes, habits that are characteristics of a person or group. And this is usually summed up to mean culture. And culture has so much to do with who we are as schools and as organizations and as individuals. But a plan allows us to be intentional. And I'm going to return to the plan shortly. So next slide. So when we talk about a plan and personal and organizational ethos, we can think about personnel and other policies to help us achieve equity. And I think it's really important to use all those policies to change organizations, to hold ourselves and our organizations accountable, and for us as leaders, as people in organizations, to walk the walk. And I think in all the organizations I serve now, I'm becoming so much more aware of what it means to live what you say you care about. And so that's one of the messages I like to leave people with today. So when we look at our missions, and that's a starting point for where we are, our missions are very similar, not surprisingly. We're both schools of public health. We're public in that way. And so we care about improving public health. You talk about preparing students to be leaders, scholars, and practitioners. We conduct public health research and scholarship, and we're active parts of our communities. So we have a lot in common. Next slide. And we have additions to our mission statement that talk about some of what's in your statement about educating the next generation of leaders and so on. Next slide. And both of our organizations have statements about our commitments to diversity and inclusion, and we frame that not just as race and ethnicity, but sexual orientation and identity and preferences and physical and learning abilities and all the things that make us who we are, make us unique people and make our organizations stronger because of our differences. Next slide. Perry was a really key part of ASPPH's coming to terms with racism as a public health issue and recent statements that have been written about our commitment to inclusion, diversity, equity, and anti-racism. And I have to say, I have seen the organization change really substantially in positive ways over the last decade. And I think Perry's had a really great impact on the organization. Next slide. So I want to just tell you a little bit about the background of our school and university before I return to our plan. UNC School of Public Health was formed officially in 1940. It began in 1936 as a division within the School of Medicine. It came to being at a time that was really still very much in the Jim Crow era of the South. Equality was not even stated as a value. UNC was not open to women or minorities for most purposes. And ill health was a way of life, both in terms of communicable and non-communicable diseases, malaria, hookworm, ringworm, many communicable diseases, but also young men who were not even eligible to be soldiers because they were so unhealthy. It was not a good time in the state. And the School of Public Health was really seen as a critical part of improving the health of North Carolinians. In this segregated world, there were some very brave and important people in the School of Public Health who tried to find ways to work around the stultifying segregation of the time. And one of them was Lucy Morgan, who was chair of health behavior. In 1945, she partnered with a similar department at what was then called North Carolina Negroes College, is now North Carolina Central University. And they created a joint program and brought students and faculty from both programs together. They would have joint dinners at Lucy Morgan's house in Chapel Hill, where she drew the shades to keep peering people away. This was a really segregated time. Next slide. Over the years, the school engaged in a lot of work to focus on overcoming differences in health outcomes between racial groups, field training programs across the United States. The first two African-American students to earn doctoral degrees at UNC Chapel Hill and from our graduate school were students of our school. And some of you may know that Bill Darity was dean at Amherst for a number of years for their School of Public Health. And his son, Sandy Darity, is an economist who's done some really fabulous work on reparations. The school started a health education training program focused on the needs of American Indians. And then I think, next slide, some of the most important work at the school came with the arrival of John Hatch, who probably many of you know, who came to the school in 1965 after getting a job at the Shep Center at UNC Chapel Hill. He went on to get his doctorate of public health and health behavior, and then became the first Keenan Distinguished Professor at UNC Chapel Hill. So John is important in so many ways. He really was one of the pioneers of community-based participatory research. His work with churches and the Baptist Convention is known all over the world. And John worked with Jack Geiger from New York at the time to create the first rural community health center, which was in Mount Bayou, Mississippi, one of the poorest places in the country. And that work became really a beacon for the country in creating a new model of healthcare that wasn't just about healthcare itself, next slide, but was also about the things that we talk about now with Health 3.0, thinking about the food people eat, and that previous picture of John looking at the crop of beans, looking at education, justice, the community well-being, and these were all parts of our history and the school's life. And many of the people that we've trained have been have really carried that message forward. Next slide. We're also really proud of our students and the work that they've done over the years. So we're about to celebrate the 43rd year of our Students' Minority Health Conference, which is the largest student-led health conference in the country. And this year, they're focusing on revolutionary healing and rebuilding. Next slide. But we're a school in the South, and like many universities, our buildings were built on the backs of slaves. And there was a Confederate monument on our campus that was erected in 1913 and was really it was an honor of the lost cause, which was really the in a sense the deification of the Confederacy and trying to hold on to that mythology of the Confederacy. And several years ago, the Confederate Monument was brought down. The chancellor at the time, Carol Folt, arranged in the middle of the night to have the base of the monument brought down. And that was a really important step for a campus in which students every day had to cross campus and pass this hideous monument to a time that, you know, I think we all would want to see long past. Next slide. And we've been going through a process of examining ourselves. So in July 2020, there was the University Commission on History, Race, and a Way Forward, which released their first resolution. And it told the stories of 4 men, and of course the buildings were named for men at that time, whose names warranted immediate removal from university buildings. Next slide. And as the resolution said, these 4 were not simply men of their times. They wielded power, wealth, and influence to define the historical moments in which they lived. Several of them were members of the Ku Klux Klan. Several of them were lawyers. One of them was a previous university president. One of them had actually killed a man in cold blood and was exonerated. These were not nice people. You know, they were names on buildings that, you know, when I listen to students talk about what it's like, or faculty, to be in a building that is named for a racist and a segregationist, and I hear the trauma in their voices, it makes me realize that the past continues. So these names, next slide, were taken off buildings, and I'll come to that in a minute. So the chancellor formed a task force to review the report and recommend names for removal from buildings, and then a second task force to recommend names to replace those that would be removed. And I'm grateful to be part of both of those task forces. It's been quite a learning experience to try to put yourself back in the time of these men whose names are on our buildings, and to really consider which ones should be removed. Next slide. Students have been very involved, and they've been part of recommending names to be added to buildings. And I hope I see the day when one of the names is for somebody that has been associated with our school, but that hasn't happened yet. Next slide. And so 4 names were taken off buildings, and 2 names now have been put on buildings. Hortense McClinton, who is 104, was the first African-American professor at UNC, and Henry Al was the first American Indian student. He's no longer living, but his family was very excited about this. So next slide. So, you know, our goal of becoming an anti-racist school and increasing inclusive excellence is in the context of a place that has a history of racism, was built on racism. And so, you know, I think it's really important to understand your history and to be very direct and honest about it. Next slide. And, you know, at the center of our work is a plan. And I think it's essential to have an intentional plan about how we're going to be a more inclusive and anti-racist school. In 2010, we had our first diversity and inclusion plan, and that we accomplished most of what was in the recommendations of that plan. And yet we realized we still weren't where we needed to be. So that it was time to commit to building the next iteration of a plan. And that's what I'm going to talk to you a little bit about now, which is the Inclusive Excellence Action Plan that we released in 2018. Next slide. It has 6 pillars, and I'll talk a bit about these: training, curricula, representation. Next slide. Communications, advocacy, and research. And each of those pillars has activities associated with it. Next slide. We have an Inclusive Excellence Council that is monitoring progress and evaluation of it. We have metrics. We regularly review the data at our Dean's Council and expect that all leaders in the school are responsible for making progress. Next slide. And we have a staff. And while these are not the only people who have responsibility for inclusive excellence, we do have a team of people whose jobs it is to help bring about inclusive excellence. And when I started as dean, I bought into that belief that inclusive excellence is everybody's job. And I didn't think we needed an associate dean, and I came to believe that although it is everybody's job, unless somebody is charged with it and accountable especially for it, that we're not going to get where we needed to be. And that's pretty much how we came to have an associate dean for inclusive excellence, which I had to meet with senior leaders at UNC to get permission to hire, because the concern was that if they let us hire somebody like that other schools would want to hire somebody like that. And guess what happened? That's exactly what happened. And I couldn't be happier. So next slide. So I want to talk about some of the ways in which a plan has to be made alive. And obviously one of the first ways is through resources. So, we started out with a couple positions, we've increased that. I expect to add more positions over time, but resources also include advocacy, how much time we talk about these things, the attention that our development operation puts into inclusive excellence. And it's been a real priority. It's been the priority of our Public Health Foundation board over the last year, especially. The assets that where we feature inclusive excellence, for example, our magazine, our website coverage, all of these things are resources. Several years ago, we created a student affairs ecosystem, and we moved academic coordinators under an associate dean for student affairs. And that's really elevated the role of academic coordinators in being advocates for students. And that's been important to our plan. Next slide. And another element of a plan is dealing with personnel appointments. So I have to say that if you just let personnel happen the way it's always happened, people hire people who look like them and that they feel comfortable with. And we've instituted over the years a number of checks and balances to make sure that we're not just hiring people who look like us, particularly white people, but people who are diverse in many ways. Most recently, our health policy and management department has been doing a pilot with equity advocates from Oregon State Health Sciences Center, trained by them. And we're looking to see if this is something we can extend across the school. We actively use the Provost's Office VTI program, which provides partial but really substantial support for faculty recruitment of diverse faculty. and the Carolina Postdoc Diversity Program, which is a very significant pathway to diversity. We've been among the UNC schools most aggressively using these programs and have been really successful in hiring people. Retention has sometimes been more of a challenge. We've been more conscious of how we do searches, and particularly for administrative positions, we've been really pushing ourselves to take a more holistic approach, placing a high value on diversity, even when a candidate's skills in their CV might not appear to match exactly. But we're trying to look at what have people done in their lives, not just what are the positions that they've had. Our senior management team is now very diverse. Our chairs are not diverse, and that's something that needs to change. Next slide. We're also using policies to achieve equity and to hold everyone accountable. So let me give you a few examples. In the last 2 years, we revised our appointments, promotion, and tenure manual so that every faculty going up for either initial appointment or promotion and tenure has a section that they're asked to complete on what they've done to make the school more inclusive, or what they would do if they haven't been here. It started out that when we talked about that, it was going to be something that people could do if they wanted, but we decided, no, this should be something that everybody does. And I think it's been really important. We've also been using we have a process of post-tenure review every 5 years, and we've included a much stronger focus on inclusive excellence in that. Our admissions processes have become more inclusive, looking at students in a holistic way. And we now have a process where students can give feedback on instructors who have created issues, have made them uncomfortable, have refused to say change their curricula to be more reflective of what's going on in society. And we're still working out what actions should be activated for those kind of behaviors. So I want to just spend a few minutes talking about the specific elements of the plan. Next slide. So the first is training for everybody. So we require yearly inclusive excellence training, a minimum of 8 hours a year, with a strong anti-racist component for all faculty, staff, and TAs. We were the first school at UNC that did this, and I thought we were going to get more pushback than we got, but we made a good argument, and Central HR at the university really supported us. And this was considered the foundation of our plan, because if people don't have training in these things, there's little hope that fundamental change will happen. So in the first year of training, we had 400 people who took Racial Equity Institute training from REI in Greensboro, and it was a pretty amazing experience. Next slide. Just pay attention to some of the highlighted sections. So we required all employees to complete the training. We launched student feedback, and we require, and we're now tracking the proportion of faculty and staff who complete the training. It's not as good as it should be, but our tracking is getting better. And we've implemented the strengthened APT manual curricula. Next slide. So you all have a really good tool for looking at curricula, and we think that it's something that we want to share it with our folks. But we require social justice and racial equity training at student orientation as part of curricula and in the classroom. Next slide. We also created 2 MPH concentrations that really came from student pushing and advocacy, one in global health and one in health equity, social justice, and human rights, that address a lot of the issues that students are particularly concerned about. And And we've been asking all of our concentrations to review curricula and make changes on a yearly basis, and particularly our core courses. Next slide. And this just shows you some of the changes that we've made. So our maternal and child health, health behavior, and epidemiology departments all made foundational changes to their core courses to address equity in 2020 and 2021. And I think that's now become institutionalized as part of the culture. Next slide. So another really key part of what we are trying to do is to increase recruitment and retention of faculty, students, and staff from diverse backgrounds. Next slide. And we're doing that in a number of ways. I mentioned equity advocates. We also created Colleen Cipriani, our previous Associate Dean for Inclusive Excellence, who Perry has worked closely with, created a program called Newish for new faculty of color and diversity, so that we make sure that they don't get lost in the system, that they get what they need. We dropped the GRE during the pandemic. I think it was a wonderful opportunity to do something that needed to be done for many years, but people never would have agreed to, probably without the pandemic. We require all admissions committee members to receive special training. Next slide. And I think what we're doing is beginning to pay off, particularly for students. So 23.5% of all students are now underrepresented students. Next slide. And we've tracked this over time, and you can see that over the last couple of years, we've gone from 20% to 23%, and it looks like we're still continuing to increase in applications. We had stagnated for a number of years. We kept doing things and nothing was really sticking. And that's when we decided that we had to change the way we were doing our work. Next slide. And we spend a lot of time as leaders in the school looking at our data, and we look at the funnel that goes from applications to student deposits and matriculation, and trying to find, as we go through that funnel, as students are applying in real time, what can we do to make changes in any given year, so that we don't lose a whole year and then say, gee, it's too bad, we could have done better. So focusing on the people of color, you can see that that over time we've seen increases, and some of those increases are undoubtedly due to the pandemic and the increase in public health interest, and some are due to actions that we've taken, and it's hard to separate what's what. Next slide. It's and our students do very well across racial and ethnic groups in terms of graduation, and Black and African American students are 95.45% graduating, but all of our students, but we have very high rates across all groups. Next slide. It's been slower to increase our faculty representation, and it's something that we're constantly working on. And I would say honestly, it's the area where I feel like we've made the least progress, but we're using every tool, and we have seen increases, but we spend a lot of time on retention. Next slide. And you can see, I'm sorry that I couldn't really change the font on some of this, but compared to other schools at UNC, we're better than most, but there are a couple that are stronger than we are. The first category is Black, the second is Hispanic, and the third is Asian. And you can just see across schools, there are some schools that have many faculty, like arts and sciences, the first bar, and not a significant number of minority faculty. Next slide. We also work really intensely on communications. Matthew Chamberlain, our director of communications, does a wonderful job. And we think of communications as really a multi-level and multi-modality process. Next slide. Where we use our website, social media, just like you would, media relations, personal communications, but we're trying to really think about how we use multiple communication modalities, blogs, community letters, all of them consistent in the messages. And when we were dealing with the Confederate statute, we decided to start framing public health in terms of racism, and racism being a public health crisis. And it's been amazing the extent to which that has allowed us to really be intentional and consistent, and to talk about public health in ways that other schools have not been able to speak. So very often I'm the person speaking out on issues on the campus. And I think it's partly because I've been really comfortable using public health as the frame. And in a way, that frame has allowed us to speak without people thinking that we're just troublemakers. I know that sounds really like a cliche, but it's given us a basis of intentionality for our messaging. Next slide. And I have a blog. I write a lot about racism and issues of sexuality and gender, and you know, I think it's important to be heard on that. So there are two more elements to the plan, and I'm going to speak about them very quickly. One is advocacy, advocating on behalf of students for living wages and fairness in hiring. We took steps to make greater transparency about employment opportunities for students. And then the sixth part of the plan is, which was added most recently, is about research and dismantling racism and promoting equity through our research enterprise, both in our culture of research and in the actual research that's done. And I'm just going to highlight these really fast before I have some concluding slides. We do research on 6 continents, 35 countries, and all North Carolina counties. Next slide. We have, I'm proud of the work that's been done by our faculty, looking at the effect of the pandemic on different populations. And this was looking at LGBT populations and vaccination, and showing that they were more likely to be vaccinated in the studies that Noel Brewer did. Noel, by the way, came from Rutgers many years ago. Next slide. We highlight the work of faculty who do work on issues of equity, and we really encourage that work and celebrate it. And next slide. And one of the ways we celebrate it is through a new faculty award for excellence in health equity research that we developed 2 years ago. Next slide. So I want to conclude with several slides on what some of my beliefs and personal behaviors about leadership. So we don't usually talk about personal giving because I think people are really uncomfortable with it. But I think it's really important that leaders give, and that they give to causes that they care about. And so for me, giving to issues of inclusive excellence and talking about it has enabled me to go out and encourage other people to do that. So I created an endowed scholarship focused on inclusive excellence in my parents' name. And by doing that, I was able to talk to people that I might never have been able to talk about this kind of giving. And it has resulted in some additional gifts. We've had chairs that have made gifts in that in honor of their family members. Next slide. I think it's also important that leaders, and I'm not just talking about deans, think about personal service as another domain of inclusive excellence. You know, what do we spend our time on? So I will give priority to requests that are around inclusive excellence, just like this talk. I'm on 2 chancellors committees, I'm on the governor's commission, and I'm on a student committee that's focused on inclusive excellence, because I think you have to put your time priorities on what you say you care about, and what do you decline. I don't decline requests that are related to inclusive excellence. Next slide. And finally, I think we all have to be exemplars of the behaviors that we want to see in others. We have to walk the walk. And, that relates to what issues, what do I talk about? What do I write about? It relates to listening, empathy, and self-reflection. Where are we not doing as well as we should? What lessons do we learn? What do we need to apologize for? What haven't we done as well as we should have? I think self-reflection is a really important part of leadership, and we can all do better. Still, next slide, my final slide. I'm really pleased that our school has won the HEAT Award for Higher Education Excellence and Diversity the last 3 years. That's just not me. It was Colleen, it's many people, but it is a reflection of commitment and intentionality, and and waking up every morning and thinking that this is important. So thank you very much for listening to me. And I hope that we can have a good conversation now. And Perry, thank you for inviting me.
Thank you, Barbara. And I really appreciate your comments and your honesty and your sincerity. And, you're like recognizing that, this is an everyday, 24-hour, 7-day a week, effort. And, I think some of the things you've spoken about are challenges we face at Rutgers too, which is, we have a very diverse student body. We have a less diverse faculty. We have very less diverse leadership, and these are the challenges that continue to present themselves, as we have our students interacting with faculty who are not necessarily, representing the diversity of the student body. I also really appreciate your comment about giving. And I did too, also started a scholarship in my parents' name as to model. Yeah, and for first generation scholars, as a way of sort of like modeling to other people that, we have to give back and help students in a way that's real. And that starts with the dean of the school. So thank you for all of you.
Thank you, Perry.
I always ask, so this 21st Century series this year has been really interesting and fascinating. I always start with the same question. It's sort of like my James Lipton question from like the Actors Studio. And I'm going to pose it to you, and I'm asking everybody this question, which is public health, population health. How do you, Barbara Reimer, understand the difference or similarities between these two constructs?
I just got an email from one of our graduates who got named to a new job in population health, and he asked me to explain the difference. I think they're highly related. To me, population health is kind of public health writ large, but I think public health is more than that. When we talk about well-being and we talk about, we also talk about individuals. And I think individuals sometimes get lost in population health because populations are made up of individuals. I know this isn't the greatest explanation, but I like public health better because it feels more personal to me. Population sometimes feels like the old public health, where it felt like we're not really concerned about individuals. We're concerned about this broad group of people, but I don't think we want to lose individuals. We specifically put that into our mission because there was a feeling that sometimes when people thought about public health, they just thought about it in this generic way. And I'm not saying that I mean, population health is about keeping populations healthy, but populations are made up of people.
Right.
And, I also don't want to lose the well-being part of public health, which my colleague Laura Linan at our school has really pushed me to embrace, that it's not just about wellness, it's that inherent well-being, which especially now with this mental health crisis,
Right.
we need to think about. How do you think about it, Perry?
Well, I think about it every single day. I think we align a lot in what I think about. I think that public health is much more engaged in looking at the intersection between people and communities and populations. I think public health has in its roots very deeply a social justice and health equity perspective. And I think population health is really a clinically oriented term about the outcomes of medical care, right? And which that kind of thinks about social determinants, but really doesn't do anything about addressing social determinants. And
Right. I'm glad you said that.
Yeah, I think the activist perspective that we have as public health people is not part of population health. I do also, in my joking times, Barbara, say, "Oh, you population health? You mean public health for MDs?" Right? So, so I grapple with it. And I think it's really important for us as public health leaders to make sure that our identities are front and center. I will say one more thing and I'll stop. It's like, did I really, really want to be ASPPH president? Kind of, I did, right? But did I really have time? Not really, but I thought it was really important that somebody like myself, who's a PhD, who's an infectious disease epidemiologist, who's
Yes.
a health psychologist, lead the organization. And so, not all of my friends who I love, but are MDs first and foremost, right? And I think it's really important for us.
I'm really glad you said that. And thank you for also pointing out the intersection of people and communities and social justice, because I think that really is important. And you don't see population health people talking about that,
Yeah.
And the person who contacted me it's a population health program that's part of a pharmacy school.
Right.
I think our colleagues in other parts of healthcare have really embraced the population health, which doesn't mean we should ignore it. It's just, we're more than that, right?
We're much bigger than that. We have the social science, psychological, sociological advocacy perspective that I think is not true in population health. But we can have a whole seminar about this one day,
Yeah. Now that you're leading ASPPH, right?
Well, I've been pushing them to think about, I know, Barbara, you remember, there was, before I was a dean, there was an effort to try to differentiate the two a few years ago. I know that Linda told me that, but I think it's something.
Yeah.
To revisit.
But it could be revisited. And congratulations.
Yeah. Thank you. I'm gonna turn to some questions, and what I generally like to do is ask the person. Can we? No, we don't do that. Okay. I'm gonna ask the question on behalf of my friend Leslie Cantor, who is our chair of Urban Global Public Health, and she says, "Thank you so much for sharing all the work with us. I'd be interested in hearing more about the retention challenges. Is it competing with private schools who can make better offers? We know that reality. Other institutional factors, we know that reality. Also, does your school public health have its own promotion and tenure guidelines?" And that's from Dr. Cantor.
Okay. Hi, Dr. Cantor. Yes, we do. They have to be within the spirit of UNC's APT guidelines, but we have our own APT manual. And when somebody comes up for promotion at the campus level, they're using our guidelines to evaluate the person. So, for example, the section on inclusive excellence, that's our guideline. And Laura Linan, our senior associate dean for academic and student affairs, sits on that university committee. So we really, and we have a great track record. We really do well with getting people promoted. Yes, so we have our own committee. I think our retention challenges are probably a lot like yours. We work really hard to help people succeed at getting promoted. And then sometimes our colleagues at Duke come along and offer more money, less teaching, better quality of life. I'm not saying that it's never about us, but I feel like we work really hard, and then private schools can offer a lot more money. And we haven't had raises for several years. This is the first year. That's hurt us a lot. I'm not hearing you, Perry. I think you're on mute.
I said, thank you for that. I think, look, we're challenged here. I mean, I've owned this many times in meetings, like at our institution, the School of Public Health is in with our biomedical and health sciences, and there's one set of guidelines, which do not always work to the advantage of the school. So
Oh,
very, very difficult for us. And I think that's what Leslie, is probably alluding to. So it's helpful to hear your school, a top-ranked school, what's happening there, because we're challenged with, this medicalized approach to public health.
so you don't have your own set of APT guidelines?
Nope, we do not.
Wow.
Yes, it's a problem, and I think there's a reckoning around that right now that hopefully will lead to a change. But it's what the reality we're living in with right now. Let me ask you this next question, and this is a question about the library. I'm curious to hear what role, if any, your library, even special collections and archives, have played in supporting the 6-part plan.
They've actually played an important role. One is in helping us to, we're having a really hard time identifying the equity, the full scope of equity publications that come out of our school. Because there are thousands of publications every year, and if they're not tagged properly, we can't necessarily take credit for them. So they've been working with us to identify, to try to help us get a better handle on publications that are coming out of the school, but also those that are focused on health equity issues. And Penny Gordon-Larson, our Associate Dean for Research, and Alexis Kelly, who is our director, have been working really closely with the library. They've also been really helpful on special collections related to the history of the school over time.
Okay. Let me ask you a question about you live. So I have there's a two-parter here, but I'm going to start with this one. There's a bunch of there's a bunch of questions in the chat here that I want to ask you. But North Carolina government, right? You are a public school in a purplish state, reddish.
Yeah, it's purple.
Purple. I mean, let's be honest. The last the governor's race in New Jersey was 52-48 or whatever, 51-49. So I mean, I don't think we should talk either. But it's but how much does government in North Carolina right now share the values, if they do, of the School of Public Health with regard to diversity, equity, inclusion, and anti-racism?
So, it's complicated being in a purple state. We have a phenomenal governor, Roy Cooper, who is, I'm on his commission on inclusion. He's got the most diverse cabinet that's ever been formed in the state of North Carolina. But frankly, we have a board of governors that is appointed primarily by the legislature. And, the governor has been pretty much relegated to a minor party. And we now have a board of trustees that is largely appointed by the legislature and the board of governors. So, things have shifted a lot in North Carolina. But I have found that, so people have come to me and said, so you can't say what you think at UNC anymore. And I don't think that's true. In fact, I had a discussion with a board of trustees member a week ago, and I said, I'm hearing from some people that there's this belief that, you can't speak up anymore at UNC. I said, what do you think? He said, I don't think that's an issue. I said, are you going to be micromanaging our tenure process? And he said, he assured me that they had other things to do besides that. I have seen no evidence of intrusion into hiring or promotion. And I understand that I'm saying that in the context of everything that people have heard about Nicole Hannah-Jones. But I think things could get more difficult. I think they're getting more difficult on public university campuses, right?
Yeah.
We haven't been told we can't teach critical race theory, Perry, but who knows?
Right. I mean, look, there's clearly this cultural shift. Well, I don't know, shift. There's this cultural movement in this country that has been enabled that allows, this states to deny books in their libraries, that to allow the state of Florida to pass a don't say gay law. I mean, it's like unbelievable to me. Actually going on. But, and it means that we have to be even more adamant and even more forceful in our approach. I think, it's always nice to have civil discourse, but at some point you have to say, wait a second, they're screaming and yelling and getting all these things passed. And here we are just sort of twiddling our thumbs. And it's kind of been my approach. But I'm like a bull in a china shop. So, don't take that example. I do want to ask about the situation last summer with Nicole Hannah-Jones and, what that was like living through that, that experience with that amazing scholar, who has now found her way somewhere else. But what was that like for you? And what was it like being a dean at that institution? What would it feel like at the school and the university?
I think it was really awkward. I think a lot of people were angry. I feel like I'm in a difficult position because I knew some things from the provost or others that other people didn't necessarily know.
Yeah.
I think it could have been handled really differently. And it wasn't. I mean, she is a remarkable scholar and it shouldn't have gone down the way it went down. And I think it could have been more deftly managed and not ended up the way it did. I just don't think I can say much more than that.
So let me. I mean, we all watched it play out. Look, and I will own this, the phenomena that happens here at our institution, which is, when scholars of color are disrespected, when junior scholars are disrespected, and not even scholars of color are disrespected, but often when scholars of color are disrespected, and they are not promoted or tenured or elevated in the ways they should be, and hear things like we can't lower the standards for the minorities, which is actually something a colleague of mine has actually said, which is unbelievable. That's
terrible.
Unbelievable to me, unbelievable. It does create a culture and it does create a reputation, in the academy around the institution. And it's one thing I'm fighting really, 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 really hard against. And it's really hard. Do you think that if there have been repercussions to those events, if you can talk to that?
Yes. Yes, I think some faculty who had been here with us a long time got really just tired of it all. They felt like they were pushing a boulder uphill and they were just never going to get where they wanted to be. I think some people became exhausted by it, but we've continued to recruit really great people. So it's one of those mixed experiences. I think that some of the people who were here were just fed up, like, really, we're going through this again.
Mm-hmm.
But it hasn't turned off people from coming, really great people from coming. We had one faculty member that we were trying to recruit at the time, and she actually asked to meet with a member of the Board of Trustees. She wanted, I admired her boldness. She wanted to decide for herself if this was a place she could feel comfortable. And she met with him and she decided to come because she felt that she was really reassured that they were not going to be micromanaging faculty appointments. I think it's mixed.
Mhm.
I wish it hadn't happened. I don't think it had to happen that way.
I do think the micromanagement of faculty appointments and decisions about faculty in the hands of a few over the hands of the many is ultimately the root of all the problems many of us face at our institution.
Yes.
Right. Or my doctoral student and now my faculty member, Kristen Krause, would say, the gatekeepers keep making things difficult for us, right? Because they're just like not letting the gates open up more widely, right? Because it's never about lowering standards, as I explained to this colleague. It's about
No.
widening standards, right?
Yeah.
It's a whole
Right.
different way of thinking about it. And, every single day we fight that here. Can I shift and talk about curriculum for a second?
Yeah.
And I think you probably appreciate the fact that, look, we can keep piling stuff onto the curriculum, right? We can we're trying to figure out right now how we, integrate a very important racism course into our curriculum and other courses that this guy wants also, which is like bio basis of public health that I think all public health students personally need, but that's just my bias, but I'm willing to let it go. But how do we keep doing this and not make it a 90 credit MPH?
Oh,
right?
Harry, I'm so with you on this. I think we really have to work with our accreditor because it's become impossible. And we're also not nimble. Our inclusive excellence team, and I want to really acknowledge their work, developed a public health history course that we thought was really important. It has a real strong element of racism. But right now it's an elective. I would like it to be part of the curriculum, but we've got so much required content and we streamlined to be 42 credits instead of, we had departments that had 56 credit MPHs before. And that doesn't make sense. It's not a doctoral degree. I just feel like this is one of the places where our accreditor, and I know I shouldn't say it, but is sometimes driving our curriculum and that we're always 5 years behind.
Right. Good news, though, Barbara, is that Linda Alexander and I are having a meeting with our accreditor.
Oh, that's great.
Next 2 weeks or
something. Oh, Linda's great. The two of you are a terrific team.
Thank you. So they're going to hear what the anti-racism effort is about that we developed at ASPPH. And I'm going to put out there this very issue, which is we can continue to educate and expand the curriculum so that it is much more rooted in social justice and health equity and anti-racism. But something's got to give here, right? And it's what it's going to give if you're keeping us accountable for all these things. So hopefully something good will actually come out of that. We'll see. But
we've got to be more nimble. I mean, we've got to be able to, respond to current events and make our faculty accountable for changing the curriculum more regularly. But the accreditor needs to back that up.
Right. What's been really helpful, Barbara, and you mentioned this earlier, was that assessment we created, that self-assessment created here at the school has been really informative to faculty, and I, as one of the faculty, will tell you that I'm teaching biostats this semester. And
wow.
Yeah, because, I don't need to sleep, Barbara. And frankly, I did it on my curriculum. And I thought I was really good about making sure that every voice was represented. And I had, female identified scholars and African-American in my readings and all of this sort of stuff. And my examples are fine, right? I know when I teach, I think about things holistically, but it was really clear to me that I needed to make changes when I did that assessment. So it was a great, great tool, even for, Mr. Oh, mine's perfect, not so perfect, Halkitis, right? In fact, you have some work to do here. And all of our faculty have really, it's been a good, if you create a tool like that, I think, which is not punitive, but is about self-reflection and an inventory,
we can all, it's quality assurance, right? It's CQI. Right. We can all get better.
Right. I mean, I think
when Dean says he can get better, that's really a big deal.
Right. I mean, it's also good, like good pedagogy. I think, like, when I teach, I make sure I ask the same type of question in 7 different ways, right? Because I want to know that in 7 different ways, the students can get to that answer, right? Because they're not just going to hear it in one way in life. So it's kind of like that. Hey, Barbara, one more thing about the ASPPH stuff. What would you like, since I have this great honor of being chair-elect starting in March, and my 3 hours a night of available time that I have to myself, which is not so much 3 hours anymore because the Olympics are on and I'm like obsessed, and and I'm up all night watching, but okay. What would you like our organization to do as you as you leave this role and you continue to be a prominent public health leader? What else could ASPPH do to help bolster our field and our schools and our efforts?
Well, that's a big one. Well, one thing I'd like to see is helping deans make it through the first couple of years effectively. I think the turnover that we see in deanships is so inefficient and so expensive. And I think we could do a much better job of helping deans to deal with inclusive excellence issues in their schools and campuses, which is really hard. And we shouldn't all have to learn the hard lessons the wrong way.
Right.
And you're a perfect person to help drive that. And I don't want public health to be forgotten when the pandemic is seen as being over. I mean, I think we have a fundamental job of continuing to educate legislators and others about what's important in preventing the next pandemic and helping people to deal with all the sequelae of it. The inequities. I mean, I don't think the current administration is yet where it needs to be. I don't think CDC is where it needs to be. I think we've got to re-partner with CDC the way we used to.
Right. In a real way. And, shifting the dialogue, right? To I don't I think Lisa Boleg said it really clearly when she wrote this in the American Journal of Public Health, maybe 3 years ago now. And I bring this up all the time with my students. I don't want to read another paper about the racial differences and disparities.
Yes.
We know they're there.
Right.
I don't want to read papers about what you're doing to get rid of the racial differences.
Right.
With regard to disparities, right? And I think, that's the work I think we really, really need to do. And I'm hoping, when I started doing interviews around COVID 2 years ago, and the folks would ask me, well, why are people of color being affected more? I'm like, I don't even know why you're asking me that question. This should be obvious to you.
Why wouldn't you expect them to be affected at first, right? They're always affected at first.
Right. But the things that you and I think about, and all of our friends here on the call today, on the Zoom today, think about in terms of structural inequities and social injustices and unequal access is not what the general public thinks, right?
No.
The general public thinks that just people are irresponsible and they get COVID or they become an opioid addict or they're obese because it's their fault somehow.
Right.
There's not this context.
They make bad choices.
Right.
Individually.
Right. Or remember in the 80s, because we're old enough to remember, with the onset of AIDS, the innocent victims, the children and the hemophiliacs, and then the people who deserved it, like the gay men, right? And the drug users, right? It was just all about behavior. And I think we have to do a better job in public health. And of course, remembering the individual, but continuing to push is individuals behave within context. And context shapes behavior, right?
Right.
And, yeah.
Right. And blame is not where we should be, right? We should be working on fixing the social structures that make, these inequities and generation after generation.
Right.
They're not surprises anymore, right?
No, this is no surprise. There should be no surprise. If this surprises you, there's a problem, right? Right. And it's I think one of the, I'm a huge fan of the arts and film, and I think that they're so ahead of everything in the way they think about the world and actually push the envelope in really effective ways. But, I don't know if you've read the book Dope Sick. I read it and then I watched the miniseries. And I thought that presentation of how life and social conditions get somebody to an oxy addiction is was very, 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 very well.
Yeah, I agree.
and it was never about the person. So Dr. Reimer, you will be missed very, very much.
I will miss you very.
But you will come and visit, and we will see each other. And are you going this summer to the meeting, or is your next does the next person?
I assume if there's a next, that the next will go, but you know, we'll see. I'd like to stay, you know, I'm not retiring yet, so
Tell Laura you need to go to San
if there are ways I can help you as president, Perry, I'd love to do it.
I'm going to take you up on that, Barbara. It's a pleasure and an honor. Thank you for taking the time today, and have a good rest of your day.
You too, and thank you again for inviting me. Bye.